I know this is certainly not settled science, but what do you think about this issue about, creating non-psychoactive or non-psychedelic derivatives, the efficacy of the subjective effects of psychedelics? Do you have a strong opinion here, or a way to start thinking about it that you think is useful?
I guess I do have a strong opinion. One should always be careful with strong opinions. But the opinion that I have is that the quality of the subjective experience is arguably the best predictor that we currently have for therapeutic outcomes. So, for example, emotional breakthrough experiences, emotional catharses, when measured, are strongly and reliably, meaning across studies, predictive of, say, drops in depressive symptom severity with psilocybin therapy for depression. So that's what we've got. That's evidence. It's just because of certain, I guess, cultural perspectives and values within psychology and psychiatry that those subjective measures are sometimes looked down on and considered, less scientifically rigorous than, say, I don't know, behavioral measure, or better than that, an objective biological one. I would say this, that things like the emotional breakthrough experience, emotional catharsis, or psychological insight, which we also measure now and find is robustly and reliably predictive of therapeutic outcomes. It's a matter of time, and maybe we're there already, until we can give a satisfactory, satisfying account of its underlying neurophysiology and neurobiology. And so in time, maybe we'll borrow more from that than we will referring to the qualities of subjective experience. But that won't change the fact that at the moment, those are the most reliable predictors that we have in human beings, which is, the species that we are and that we're most interested in and that we're trying to treat.